Resuming debate, the honourable member for Richmond Hill.
Thank you, Madam Speaker. Madam Speaker, I'd like to state first that I'll be splitting my time with a member from Skeena, Balky Valley. Today, as I rise to speak on Bill C-31, an act responding cost of living relief measures related to the dental care and rental housing, I feel proud. I feel delighted, and most importantly, as indicated in the name of the act itself, I feel relieved. Relief from the fact that this piece of legislation has laid the groundwork and complemented other programs, and through its two main elements serves to address some of the most prominent affordability concerns in Canada, and more specifically in my riding of Richmond Hill. Madam Speaker, it is a known fact that following the COVID-19 pandemic and all global and domestic challenges that have risen since, Canadians have been deeply impacted by the rising cost of living. Addressing such large-scale issues cannot happen overnight, but rather through a multi-step and gradual process, which is exactly what is offered in Bill C-31. Madam Speaker, allow me to provide a brief overview of the bill by breaking it down into its two main components. First, dental care, and second, housing. These are two domains that affects not only the financial but also physical well-being of each and every Canadian. And our government's focus on enhancing each of them is widely apparent through this bill. To give a quick summary, Bill C-31 will make life more affordable for families across the country by providing dental care for Canadians in need with a family income of less than $90,000 annually, starting with children under 12 years old in 2022. It will also provide immediate relief for individuals and families struggling with housing affordability through a one-time $500 supplement to the Canada Housing Benefit. Madam Speaker, every Canadian is entitled to good oral health regardless of their financial situation. It is estimated that about one-third of Canadians do not have any form of dental coverage, and that 1 in 5 have avoided dental care because of its overwhelming cost. This is a dark reality for many low-income families. Madam Speaker, no Canadian should sacrifice their well-being and face long-term health issues because of their inability to afford seeing a dental professional. This is why we continue to work tirelessly across provinces and territories to ensure that accessible dental care is delivered to those who need it the most. While our government continues to develop a durable and inclusive national dental care program, which will provide $650 a year to eligible parents for the next 2 years, it will also ensure timely dental appointment and checkups for children. As a member of the Health Committee, I had the pleasure of hearing remarks from the President of Canadian Dental Association, Dr. Lynn Tompkins, during my study on the topic of children's health. Dr. Tompkins testified that tooth decay remains one of the most common and preventable childhood chronic diseases in Canada. Beyond the risk of pain and tooth loss, the effects of absence of dental care for children can be devastating. Missing school, improper eating, and lack of sleep are among the factors which arise from the lack of dental treatment for children. In the words of Dr. Tompkins herself, nothing is more heart-wrenching than having to treat a young child with severe dental decay. The experience can cause lasting dental anxiety and fear. This is why the Canadian Dental Association welcomed our government once-in-a-generation federal investment in dental care. The Canadian Dental Association expressed its appreciation of the phased approach being taken by government toward this issue. This gradual approach will allow time for consultation and collaboration with all relevant stakeholders on a long-term solution to improving access to dental services. Madam Speaker, Bill C-31 also puts another key objective forward, ensuring every Canadian has a safe and affordable place to call home. We all know that the affordability crisis is at the top of Canadians' mind. As such, during the summer, I had the opportunity to catch up with many community members and leaders through events such as our Community Council breakfast meeting, where my constituents shared their concern about their daily struggles to make ends meet. For many renters, the high cost of living has resulted in an increasing challenge to find housing that they can afford. And that is why this legislation has arrived at the perfect time. When passed, this will put hundreds of dollars back into the pockets of millions struggling with an increased rent cost through a one-time $500 top-up to Canada Housing Benefit. This top-up is in addition to Canada Housing Benefit, which already provides an average of $2,500 to thousands of working individuals and families from coast to coast to coast. I want to emphasize that this payment is part of a larger, comprehensive plan to assist Canadian families nationwide. Madam Speaker, our housing strategies and programs have been successful in many ways. As a singular example, the launch of Affordable Housing Initiative back in 2016 aspired to create 4,000 units of housing. Instead, it has yielded 19,000. Following the legacy of this initiative, our plan will put Canada on the path to double housing construction over the next decade. Madam Speaker, these are only two highlights of the consistent initiative our government has taken to achieve affordable and sustainable housing for more Canadians. And at this time, we are on the right track to accomplishing just that through the passing of Bill C-31. Madam Speaker, allow me to demonstrate just how important this piece of legislation is to the people of my riding, and most importantly, to the key community leaders and service providers that strive to provide life-saving support for people experiencing homelessness year after year in Richmond Hill and across York Region. Madam Speaker, Blue Door, as the largest emergency housing operator in New York Region, strives to provide emergency housing support services to children, youth, men, women, and families at the risk of homelessness. Blue Door's housing emergency program has lifted 500+ individuals out of poverty by helping them navigate through COVID-19, provided over 19,000 nights of safety and for homeless individuals, and served over 64,000 meals for the vulnerable population across York Region. Madam Speaker, I continue to hear about the tremendously positive impact that Blue Door makes in Richmond Hill through programs such as Mosaic Interface Out of the Cold. Every year from November to June, homeless adults and youth in Richmond Hill are provided with essential support in Richmond Hill's Presbyterian Church as one of the Blue Door's emergency housing sites. Speaking of community leaders and heroes, the 360 Kid organization in Richmond Hill is yet another key community service provider which provides kids in crisis with care. Day in and day out, Clovis Grant and his dedicated team at 360 Kids help youth make positive changes in their life by overcoming barriers and moving from crisis to a place of safety and security. Madam Speaker, I can confidently affirm that passing this important piece of legislation will have a direct and positive impact on the life of people such as the 360 Kids and Blue Door service users. Madam Speaker, I urge members to support community leaders across all ridings like Michael Brett White, Clovis Grant, and their dedicated team from Richmond Hill, who provide housing services to our most vulnerable by passing this legislation so we can provide a safety net for those who need it the most. Thank you, Madam Speaker.